Yay Networks.
So many of us, all of us, really, women, men, we are trying to feel our very best no matter our age. And we're in an era of individualized healthcare. We look at things through the lens of precision medicine. How can I tailor something to be specific for my needs, for what's best for me? And that is exactly what we're talking about today as we look into the topic of bioidentical hormones. A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. In today's episode of Fueled Wellness and Nutrition, we are covering bioidentical hormones, and this is a more natural approach to hormone therapy. And really, the topic of hormones is often overlooked. It's dismissed as something that only women who are going through menopause need to even think about. The reality, though, is that we can't underestimate the influence of hormones, no matter what age we are, no matter if it's women or men. We can't underestimate the influence of hormones on how we feel, how we look, how we age. Our hormonal balance even influences the chronic diseases and the conditions that we either will or we won't get. Our hormone balance also influences the core of who we are. It influences our mood, our energy, how we handle stressful situations. There's the clinical implications, of course, the risk for cancer, hypertension, low bone density. Then there's the aesthetics, the lighter stuff, and how our hormones affect our skin and our hair. So all of this is to say that maintaining that optimal balance of hormones for our specific makeup is essential. And for many women, this starts way before menopause, and it applies to men also, not just women. So in today's episode, we're going to talk about bioidentical hormones, where to start, how to learn your current hormonal status, how to learn which hormones you may need to get more of, whether it's estrogens or progesterone or testosterone or a blend of these. We'll talk about the different types of bioidentical hormones, including compounded and FDA-approved versions. Also, the different modes of delivery available, from patches to pills to creams to injections or gels. The array of options can be overwhelming. There's literally thousands of products out there, and it is a delicate balance. It's not something to take lightly. It's important to do this with guidance from an expert. So, to help us learn more, to help guide us through this journey, we are joined by Pamela Egan, owner of Egan Wellness Clinic in Covington, Louisiana. Pamela is a board-certified family nurse practitioner with a doctorate degree in nursing practice, along with a master's degree in metabolic and nutritional medicine. And in her practice at Egan Wellness Clinic, Pamela works with hormonal balance day in, day out, patients of all ages. She works with men, she works with women. She is absolutely expert in this. She knows the area through and through. So I'm really grateful for her to take the time to walk through with this. So with that, welcome, Pamela. I am excited to have you with us. This is something that, in researching for this podcast interview with you, I've learned a lot. And in our conversations, kind of our pre-podcast interview huddles, we've talked through it, and I've already learned so much. So I'm looking forward to even learning more. And I know that's the case for our listeners. Some hormones, it's something that I think it's tossed around in conversation, and we have an idea of it, but so many of us don't really know or have that full understanding of hormones as it relates to our entire, how we live our life and just how we feel, because it goes way beyond just menopause.
So, yes, hormones, just the general philosophy of anti-aging medicine is that hormones keep our cells young and healthy. So as we go through life, if we keep our hormones balanced, it's actually going to help us obtain that optimum health status, possibly even lower risk of breast cancer and other diseases that are related to hormones.
Yeah. And so I think when people think hormones, a lot of times they are thinking sex drive was the first that comes to mind if someone's thinking about their testosterone levels. But, it's your brain function, it's metabolism, it's energy. And when our hormones are out of balance, we can start to experience symptoms that we may think of like, that foggy thinking or mood changes or losing muscle mass or weight gain that we may not even realize are related to that imbalance in hormones. And I love that we can hear your dog in the background. It's like dinner time for him. And it's also, when we're talking hormones, it's not just women. This is something that is a very relevant conversation about men as well. And so you have female patients, but you also have plenty of male patients who are coming in.
Yes, our practice actually treats all ages, men and women, men and females. And the overall goal is to restore balance both nutritionally and hormonally in their bodies, which is going to slow down aging and prevent disease.
What are some of the side effects of a hormonal imbalance that maybe people are surprised are related to that? Things that they wouldn't think. We talked about kind of that foggy thinking or changes in mood or weight gain, low energy, but is there anything that people are coming in for and they're really surprised, or maybe they're not coming in for that in particular, but they're having some type of side effect or issue that they had no idea could it be related to a hormonal imbalance?
Absolutely. Women 35 and up frequently come in, they feel depressed, they feel anxious, they're not sleeping at night, they may have vaginal dryness, they may have headaches, joint pains, low libido, on, and not realize that that's hormonally related. So, when they go to a conventional clinic, they may be offered antidepressants, sleeping pills, Xanax, and in actuality, they just need some progesterone.
Right.
So in functional medicine, we're going to start with the basics first, and down the road, if they need medications, then we'll add them. But 9 out of 10 times, when the hormones are balanced and the cofactors are balanced, they really don't need those drugs.
But like you said, if someone is experiencing anxiety, often the idea is I feel depressed or I feel like I'm anxious and we want to band-aid that issue, or I have joint pain, let me take anti-inflammatories. We want to band-aid that issue. Whereas what we're looking at with this is balancing that whole health, that whole body health. And we'll talk in a minute about what the difference is with bioidentical hormones compared to just kind of conventional non-bioidentical. But before that, talk to me about how hormone levels are measured. If you do it primarily by blood draws, if it's saliva, if it's by gauging symptoms. So how do you assess baseline for hormone levels?
There's different ways to measure hormones. In our clinic, we primarily use serum unless the patient comes in and asks for saliva or urine. I just find that the serum levels are the most accurate, and you can use ranges. So as long as the hormone levels fall within a certain range, then, that's what we're shooting for. 24-hour urines, which are very accurate. There's saliva tests. And we have those kits in our office. We just don't use them as readily as the serum.
And you and I did, I came to you, we did an assessment of full blood work. And what's great is, someone comes to you as a patient, they have that assessment with you, and they can go to a lab that's convenient for them. And then they get the results, and then you'll review the results with them. So for me, you did a full battery of tests, and we'll talk about that a little bit as we go, but it was all just really going in like you are your normal blood work. And you're looking at hormones, and then you're also looking at other components for people, things like iron levels, other kind of markers that you're going to look at beyond just hormones. So we do that. You assess what their baseline is. How much do hormone levels vary day to day, though? To make it, does it make it challenging in getting kind of that accurate read, or do they also vary based on time of day?
It's always more accurate to check hormone levels in the morning. So we aim for 8 a.m. But again, there's a range. So if it's just not going to fit in with the patient's schedule, then we just check it. And then down the road, if we need to bring them in earlier, we will. As far as fluctuation, yes. So we have what's called a luteal cycle for women. If they're still having menstrual cycles, day one of the menstrual cycle is day one of the luteal cycle. So typically you're higher on estradiol the first 2 weeks and higher on progesterone the second 2 weeks, so that if a woman comes in and can give us a date of their last menstrual period, then and they're higher on estrogen, certain time of the month, that may be why, because you do have some fluctuation in hormone levels depending on where you are in that cycle.
And so when we got my results back, I looked at it and it gave me a range for some of the different hormones, like a range of normal, and that range of normal varied based on where I was in my cycle. And so, again, knowing that women who are still menstruating, knowing where they are in that is going to matter for knowing where they fall in terms of that normal within normal limits range. So someone comes in, typically it's going to be blood work. They get their blood work, you get the results back. And then when you're looking at what your level of treatment is, the next step in terms of treatment, and we look at bioidentical hormones. Talk to us about what bioidentical means versus conventional hormones.
So if you look at birth control pills and synthetic hormones such as Premarin, Prempro, those are made from chemicals. They're not identical to what the body would make. And when you talk about bioidentical hormones, they may be made from plants, but the chemical makeup is the same as what the body made in its younger days.
I think it's also really important to note that bioidentical hormones are FDA approved, and they're often made by pharmaceutical companies that are well-known, large-scale pharmaceutical companies that have protocols in place for manufacturing protocols, purity, there's regular testing. I think sometimes people think when you think of bioidentical hormones or you think of something that might seem more like that alternative treatment, people may have these visions of like a guy in a van by the river doing this, but that's not the case at all. These are FDA approved and in most cases, and they are made in facilities that are going to have very stringent protocols.
That's correct. There are compounded hormones, which are made in a compound pharmacy.
Yeah. Talk to us about the difference there.
They have guidelines that they have to follow as well. The beauty of the FDA-approved bioidenticals is that, number one, insurance will help pay for them. And number two, you have the FDA backing behind the hormones. So they come in many different forms. They come in gels, patches, pills, although we don't recommend oral estradiol due to liver involvement. So our patients only get topical or transdermal estradiol. But progesterone does come in a capsule, and we frequently order the Prometrium or the bioidentical progesterone from the regular drugstore. And they're bioidentical, so they work perfectly fine.
I think that gives people that peace of mind, knowing, okay, that FDA oversight. Let's take a minute to talk about Shirley, one of our sponsors for this week's episode. Y'all have heard me talk about our annual Alcohol Free for 40 event, which has been just incredibly eye-opening when it comes to our relationship with alcohol. And I love that there are so many mindful drinking support systems these days, from Dry January to Sober October. There's also so many more zero-proof alternatives like Shirley. The team behind Shirley spent nearly a year working with the finest winemakers in California to create a line of non-alcoholic wines that don't compromise on flavor. We know that going alcohol-free can be tremendous for our mind and our body. Enhanced mental clarity, better sleep, solid energy, less bloating, less anxiety, less moodiness, all of this. So elevate your potential. Consider taking the time to reevaluate your relationship with alcohol And it doesn't have to be complicated. The key is to find replacement behaviors that can work for you, like meeting friends for a walk and talk instead of drinks, or swapping your evening glass of wine for Shirley. Try it for yourself. Head to highshirley.com and use promo code FUELED for 20% off your first order. For dry January, alcohol free for 40 and beyond, there's no better time to try it. The difference with compounding is that they are, I guess, help explain that. So someone comes in and you may have just a straight, you're going to supplement with this one bioidentical type of progesterone. But if there's what are the cases that you would turn to a pharmacy to do compounding, and explain to our listeners like what that means, a compounding pharmacy?
So some patients come in and request a compound pharmacy. In their mind, they think that it's more natural. Cases where we would use a compound pharmacy is, say, their budget is such that they can't afford the FDA-approved versions. A compounded cream can include estrogen, testosterone, DHEA, pregnenolone. So you can put more than one hormone in the cream. And so that's convenient for a lot of people. They can compound anti-allergenic formulas. So say a woman is allergic to peanut oil, which is what progesterone or prometrium has in it. So if they can't eat peanuts, then we do have to compound them an anti-allergenic formula.
So convenience would be one. Like if there's multiple types of hormones that would go into one, in theory, they could have all separate types of treatments, but for convenience, like you said, compounded, combined into one product. But even those compounding pharmacies, again, it's not the guy in the van by the river. Like these are compounding pharmacies also have strict oversight and strict protocols that they're held to.
That's correct.
One more note on this before we kind of get into the different types of hormones. Well, actually, we'll have a few more things we'll talk about before, but when we're talking about bioidentical hormones, clarify the difference between bioidentical hormones that we're talking about, kind of the natural versions of the progesterones, the testosterones, the estrogens, and natural hormones, what a lot of people might refer to as natural hormones, things like black cohosh or wild yam.
Herbs are not hormones, and what I try to explain to our patients is that, you know, they may come in on black cohosh and they're like, oh, it's really helping my hot flushes. But once you're menopausal, your organs go south. They don't make the hormones they used to make in your 20s and 30s. So if you want to slow down the aging train, you have to take a little bit of hormones. And honestly, the research shows that a small bit of hormones is therapeutic. So you don't have to get to the therapeutic range. Even a small amount is going to be protective for things such as bone density, preserving your bone density. And actually, more women die from broken hips from osteoporosis than they do from breast cancer, blood clots, and heart disease. But I know overall women are afraid of breast cancer.
Mm-hmm.
So, you know, that's one of the big reasons they're afraid to
take anything. Yeah. So they want to steer clear of all, whether it's traditional, conventional, or whether it's bioidentical. There's a lot of fears there. And there was the Women's Health Initiative. Talk with us about this. This is a huge, huge study that really was a lot of kind of what is fueling those fears. So talk with us about this.
The Women's Health Initiative came out in 2002, and they studied Premarin and Prempro. And at the end of the day, the Premarin arm increased breast cancer, blood clots, and heart disease. But the Prempro arm, which had synthetic progestin in it, increased breast cancer 800%. So at that point,
and talk to us about what's in both of those. So Prempro and Premarin. Talk with us.
Premarin is conjugated estrogen, so they make it from horse urine. And Prempro is a conjugated estrogen plus the synthetic progestin, which is a chemical that was made to mimic progesterone, but they're really very opposite in the way they act. The only similar action is that they both slough off the lining of the uterus.
And so the Women's Health Initiative.
So the Women's Health Initiative showed that breast cancer was increased 800% in this Prempro arm, and basically scared women half to death, providers half to death, and hormone replacement therapy came to a sudden stop. And so women were taken off their hormones. They were told they caused breast cancer, and providers were just paralyzed into inactivity. So they just were afraid to touch hormone replacement altogether. And it's really kind of tragic because it destroyed women's quality of life. So, in my book, I did research safety and quality of life. And when you think about it, a woman at age 50 has half her life left to live. And because of fear, her quality of life is horrible without hormone replacement. So, the Women's Health Initiative really stymied the whole bioidentical hormone industry.
But what was different about that is it was using, and correct me if I'm wrong, but I believe you said it's a synthetic estrogen, and also one of the big differences is that it was an oral estrogen. That's
correct. So we know that oral estrogen is very hard on the liver, especially as women age. So the rule of thumb is if you're over 35, you really should not be on oral estrogen at all, because the liver is going to metabolize it to estrone, which is the bad estrogen that causes breast cancer, blood clots, and heart disease. So the problem with the Women's Health Initiative was, number one, it was synthetic chemicals. Number two, it was oral estrogen. Again, with the research, it shows that when estradiol is administered transdermally in a patch or topically in a gel or a cream, balanced with natural micronized progesterone, there's no association with breast cancer, blood clots, or heart disease.
Which is tremendous, because before, I read that the use of hormone therapy plummeted by nearly 80%. When the Women's Health Initiative came out. And that's tremendous. And there was kind of these two, it was like a push-pull, because it was, okay, either the thought was, I'm going to take these hormones, and the idea is that taking hormones is going to help to, the things that a woman would associate with, air quoting, like staying young, but healthy bone density, like you said, libido, sex drive, energy, these things that they're going to, hot flashes, the things that are going to support the comfortable quality of life. But if I take these hormones, then the fear is I'm going to get breast cancer, heart disease, and so to have a solution that it doesn't have to be this either or. You have something that's kind of, back in the day, I think before the Women's Health Initiative, hormones were almost like held out there as like a cure-all for everything. And so this is sort of kind of like meets in the middle with this very natural approach. And your approach is not, let's add in high doses of these hormone levels, but let's give just enough to have that therapeutic benefit.
That's correct. And that's one of the reasons that I won't participate in pellets in our clinic. I get lots of complications from pellet installation, and basically it just gets the estrogen and testosterone levels too high. That's the bottom line there.
For someone who doesn't know, tell us what that means, what pellets are.
Pellets are tiny little rods that are inserted in the hip, and usually it's like 6 to 12 pellets, and the pellets that are inserted are estradiol and testosterone. So yes, they are bioidentical. The problem with pellet therapy is that it gets the levels dangerously high. And when you're dealing with hormone replacement therapy, more is not better. You want just enough to slow down aging of the cell. So if you get testosterone levels too high, say, the woman could experience acne, hair loss, hair on her face, changes in voice, a libido that's equivalent or more so than males. When estrogen levels get too high, it can cause dysfunctional bleeding. It can cause fluid retention, weight gain, moodiness. So, there's a fine line.
Mm-hmm.
And the goal is to just restore balance to where the woman feels better and she gets all the benefits of the hormone replacement, but doesn't get adverse effects.
And something like the pellets, are they able to be removed if someone is having that, or are they not? Do they?
Not once they're inserted. So, typically a person will go for pellets every 4 months. And many facilities don't even check levels. They just put the pellets in every 4 months, every 4 months, every 4 months. So the first couple of times people love them because libido's back and, joint pains are gone. But once those levels hit the high levels, then intervention is needed. And when you can't take the pellets out, there's only so much you can do.
And you'll have some of those people showing up in your office who are like, help.
Correct. I do. And I mean, I had one lady in particular that was told she needed a hysterectomy, and it was all as a result of pellets from dysfunctional bleeding.
Wow.
We did get her under control with Arumadex, which is a drug used in breast cancer patients to bind up estrogen. So once her estrogen level came down, the dysfunctional bleeding subsided.
And no hysterectomy needed.
No, she did not need a hysterectomy, thank goodness.
Let's take a minute to talk about Ritual, one of our sponsors for this week's episode. Protein isn't just about building muscle mass. Protein also has a whole host of benefits, including supporting our bone health. It keeps us feeling fuller longer. Ritual's Essential Protein is a great tasting plant-based protein powder with 3 distinct formulas designed to meet a variety of protein needs. I love that Ritual offers a super flexible subscription service, and it's really easy to incorporate it into our own daily rituals. The Ritual difference means that it's traceable. With their completely transparent supply chain, you can know the ins and outs of every single ingredient. It's also sustainably sourced. Each blend is packed with 20 grams of protein per serving, made from sustainably grown peas, regeneratively farmed right here in the United States. And no added sugar or sugar alcohols. It's also soy-free, gluten-free, and non-GMO. So if you're ready to shake up your protein ritual, get 10% off during your first 3 months at ritual.com/fueled. Ritual even offers a money-back guarantee if you're not 100% in love. Visit ritual.com/fueled today for 10% off your first 3 months. And when we're talking about the different types of hormones, walk us through, there's of the estrogens, there's estradiol and estrone, and then there's progesterone, there's testosterone. Walk us through just a little snapshot of each, and sort of, I just think it's interesting to hear kind of what the role is of each and how we receive those hormones. Like you said, in some cases it may be topical. It might be transdermally through a patch or a cream. Some could be orally, some may be injections. So walk us through each of these, I guess, starting with the estrogens, moving to the progesterones, and then testosterone, just kind of what the benefits of each, and maybe if these are low, what symptoms people would be feeling.
So estradiol is a very important hormone for women. In fact, it's been known to prevent dementia and Alzheimer's disease, keeps the skin beautiful. So as women age and they lose their estrogen, they get wrinkly, dry, leathery-looking skin. So it keeps the skin, the hair, the nails, all in good health. And then some of the main symptoms would be the hot flushes, the night sweats, the vaginal dryness. So as a woman loses her estrogen, the vagina atrophies, which can lead to incontinence, bladder infections, painful sex. So you hear commercials for Detrol and other type drugs for incontinence. A little bit of estradiol in the vagina will solve that problem 9 out of 10 times. So
And that's one that you say not orally. So taking the oral estradiol is too hard on the liver. So only topical transdermally.
Transdermal, yes, ma'am. Only topical or transdermal is what's been shown to be safe in the literature.
And so would that be through a patch or a cream are the two main options?
Or a gel.
Or a gel.
So some of the FDA approved ones would be like Divigel, Estrogel, Minivel patch, Bivel patch, Dottie, estradiol patch. So the patches all come in generics now. The gels usually don't. Or you can get the estradiol cream compounded.
How does someone know how much? Because it seems like, recently, I think I told you I did I had some precancer cells in my hairline, on my skin, on my face. And so my dermatologist gave me it's a chemotherapy agent, a topical chemotherapy agent. And the intent was to put it just in that patch, just in the hairline. And I applied liberally and applied to my face thinking, well, if I'm going to address precancer cells on my face, let's do it on my whole face. Wow. Just like you said earlier, more was not better. I had a full-blown reaction, blistered infection. I mean, it was horrible. But with that, when my dad took a similar product, the instructions that were given to him were apply the size, a dot of this cream, the size of a grain of rice. And I thought, oh my gosh, I had a good old serving of rice worth. I mean, I had liberal, because just like we would think sunscreen, let me be really liberal with this and let me make sure it's applied really fully. That was my thought with that. So when I think about, okay, I went really overboard, not realizing as I was doing it that I was. So how is that controlled with dispensing of the hormones?
When I start patients on hormones, I start with the lowest dose, and then we bring them back in 3 months and titrate up slowly. So if it's an estradiol prescription, we're going to start with the lowest dose, which is, if it's a patch, it's a 0.025 milligram. If it's a gel, it's half of a pump or half of a packet, which is, again, 0.25 milligrams.
And do they have, so half of a pump, is there like a measure that it gives a click, or a measure or some other indicator that someone would know what that dosage is?
Not on the pump, and it's not an exact science. So within the 2 days, they're going to get their dose.
Okay.
It's hormone replacement is really not an exact science. It's kind of like a dance. So what I tell our patients, if you get breast tenderness, then you want to back down, hold the gel or the patch until the tenderness subsides, and then use half a dose. If it's progesterone and we start with the lowest dose and they're still not sleeping after a month or two, then we're going to go up to the next dose.
So with the estradiol, does it come in pouches? It sounds like, to where that pouch might be a 2-dose amount, and they're doing half of that?
Well, there's packets.
Okay.
So typically they would apply the whole packet to their arm.
And that would be considered a dose?
A dose, yeah.
Gotcha.
So it comes in different dosages, like 0.25, 0.5, 0.75, and 1.
And it's not just this big tube that they can just squeeze and squeeze and squeeze, like...
No.
Yeah.
It's a tiny little bitty packet.
Okay. Because that's, because again...
And then the pump is just going to be a pump, or I might say just use a half a pump.
Okay. Okay. No, I think that's because, I know I'm not alone in that a lot of people do think, well, if this is going to be helpful, let me make sure that I'm getting enough, or let me, that a little bit of that more is better. So estradiol being that the estrogen that's protective for our memory, for our skin, our hair, bone density, that bladder health. The estradiol is transdermally or topically. So the patch or the gel or the cream, like we've talked about. Talk to us about the difference between estradiol and then estrone.
So you have three main estrogens. Estradiol is the main one. Estriol is the weak one that never shows up in the blood work. So we don't even check for estriol. It's very weak. They actually put estriol in compounded creams in Europe to prevent breast cancer. So it's been shown to have some
protective effects.
Some positive effects against breast cancer. Estrone is the bad one. So we don't give estrone to patients, but if their detox pathways are clogged up, they may have high estrone levels. You have xenoestrogens out there, which are considered toxins. Plastics, BPAs, biphosphonates, cleaning solvents, alcohol, soy products, pesticides. Those are all considered xenoestrogens or estrone. So we ask our patients to avoid xenoestrogens if they can. If they like to drink wine at night, I may ask them to cut their wine in half if their estrone level is high. But when we start them on estradiol, we measure estrone to make sure it stays below 50. And that's the safe range to keep it in.
Because estradiol could be converted to estrone, so you want to make sure that that's not happening?
It can be converted to estrone, especially if they're having issues with detoxification.
Okay.
And estrone is the bad estrogen that will cause breast cancer, blood clots, and heart disease.
And did you tell me that fat cells are partly part of what's responsible for making estrone? So
Yes,
someone with obesity.
That's correct. Fat cells do make estrone. So an obese woman very frequently has high estrone levels, so she may not get any estrogen at all.
And we know that obesity is also linked with that increased risk of breast cancer, and that's likely a strong part of that correlation.
Yes, that is correct. Ovarian cancer as well.
And progesterone. So we've talked kind of the estradiol versus estrone. We don't add estrone, and you make sure that you're keeping that in check. So if you are adding the estradiol, you're also still keeping an eye on that estrone. And then the progesterone, talk with us about this.
All of our patients 35 and up get progesterone in the practice. Progesterone is a good hormone. It's the hormone you make when you ovulate each month. So in your 20s, just think about it. You're not depressed. You're not anxious. You want sex. You're not overweight. So progesterone is considered the weight loss hormone, the natural antidepressant, anti-anxiety, sleeping pill. It actually stops proliferative growth in the breast, so it's been shown to decrease risk of breast cancer. It builds bone density almost as good as estrogen, so it helps to prevent osteoporosis. So it's actually a very good hormone. It helps to keep the estrone in check, and women love it. I do use a lot of progesterone in my girls with polycystic ovarian syndrome. So polycystic ovarian syndrome is very similar to insulin resistance or diabetes. These young girls may have a darkness behind their neck. They're usually overweight. They have too much testosterone and DHEA in their body, so they grow hair in their face. They have acne. It's hard for them to lose weight. So we do use progesterone in that age group.
And is progesterone something that, do you use it in all patients or most patients? Do you base it on their blood work results?
It depends on their blood work results, but typically 35 and up is when their progesterone levels drop. If they've had a tubal ligation, they frequently don't have any progesterone. They're higher in estrone following the tubal ligation. Perimenopausal women, usually that's all they need is progesterone. And progesterone helps to keep those estrogen dominant symptoms in check.
And this is one that is taken orally, preferably. You say that it's, FDA approved, it's oral. It's not so much something that would be typically you would use in a gel or topical.
Right. And the reason we use progesterone orally is because they do get the sleeping pill effect, the antidepressant, the anti-anxiety.
Okay.
So, again,
women are going to be like, sign me up.
Yeah, women 35 to 50, typically that's when they start not sleeping at night, feeling anxious and feeling depressed.
Mm-hmm.
And rather than using drugs to put Band-Aids on those symptoms, the progesterone corrects the problem.
It's something that, based on my results, you and I started just a small dose of progesterone. I didn't feel that I was having trouble sleeping or any of those things. But based on results that came back, we started with that low dose. You also were looking at progesterone, taking that to potentially influence testosterone levels. So talk with us about that, how that works.
Well, progesterone, it can convert to testosterone, more so the DHEA that goes with adrenal stress or adrenal fatigue. DHEA is a direct precursor to testosterone, and you've also got pregnenolone, which is the grandmother hormone that falls right under cholesterol. A lot of people don't realize that cholesterol makes hormones. So those of us in an anti-aging practice don't really like cholesterol as low as it'll go, because if you get it too low, you're going to age prematurely. So there's cholesterol, then there's pregnenolone, which is the grandmother hormone, and your pregnenolone receptors lie in your brain. So they also refer to it as the memory and the sleep hormone. So that's one you would take at night when you go to sleep, and that's just a supplement. It's non-prescription. And then you have the DHEA and the progesterone. Then you have testosterone. So it's kind of like a little cascade.
Let's talk a bit about Headspace, one of our sponsors for this week's episode. Do you sometimes feel like your mind just doesn't have an off switch, that thoughts keep swirling, or you feel tired no matter how much you're sleeping? These are just a few ways that stress and anxiety can impact our mind and our body. So considering making small changes to your daily routine can have a big influence on your mental health and well-being. This year, turn to Headspace for support. Headspace has data behind it supporting that it truly can help us to manage our feelings and our mental health. So whether your goal is to relieve stress and anxiety, sleep better, or improve your focus, Headspace is your daily dose of mindfulness for real life. Using the app for a few minutes each day has helped me feel better, helping to let go of that swirl of thoughts, helping to be more present. One of my favorites is Headspace's appreciation course. It helps to keep us dialed into what really matters. However you're feeling, try Headspace at headspace.com/fueled and get 1 month free of their entire mindfulness library. This is the best Headspace offer available, so go to headspace.com/fueled today. That's headspace.com/fueled. So in my case, my testosterone levels were low, but again, I'm not having really any noticeable symptoms or anything that, you said, is there anything that's really affecting your quality of life? And my answer was no. And so you opted, instead of saying, well, we'll talk a little bit about the different types of testosterone. It could be injection or a compounding cream. But you said, no, we don't want to start that, because just like you said earlier, it's not let's dose up. It's let's start with the lowest dose possible that we might see improvement by. And so in this case, you said, let's start with progesterone, because that can, and DHEA, because those can influence testosterone levels. And let's do that. Let's wait. Let's see how the testosterone responds to that before taking that step. Because talk to us about testosterone, like with women and with men, but why you don't recommend it orally, why it's injection or compounded, and kind of what side effects can be and all of this.
So we don't give testosterone by mouth as with estrogen for the same reason. The liver can convert it to estrone, which can increase breast cancer and uterine cancer.
Okay.
If a man comes in and his testosterone level is a little borderline, but his sexual function is fine, and he's building muscle when he works out, and he's not falling asleep after dinner, and he doesn't have a big abdomen, I would say then just wait until you have symptoms. There's no real rush to start testosterone if everything's working fine. For a woman, again, if her libido is down and she's, complaining that she's working out and she's not seeing any muscle development, or maybe she's got osteopenia or osteoporosis, or she's got memory loss, then we may recommend a low dose of testosterone, even though it's not FDA approved in the United States.
For women?
It is approved for women in Europe, but not in the United States. So women typically would either have to get their testosterone compounded, or we recommend testosterone cyprinate injections every 6 to 8 weeks.
And people will
very,
inject
very
themselves?
tiny dose.
Okay.
Well, we give the injections in our office for those who want to swing by and get their injections. But otherwise, either we can teach them how to give the injections, or a spouse or the pharmacist where they get their
Really? A pharmacist will do that?
Them.
Oh, we'll teach them.
Well,
okay.
They can teach them how to give it. Yeah, they won't. I don't think Walgreens will give shots without
I was
charging
thinking,
people.
How did I miss this?
But the pharmacist could certainly teach someone how to give an injection.
Right. So when we look at testosterone, I think that's one that people are so familiar with: libido, energy, muscle mass, but also things like bone density, like you said, memory. Never orally. It would be injection or compounded cream. And
Correct.
It's not anything to play around with, though. Like we said with me, you looked at lab results, testosterone was low, but that was not your first step of treatment, was not to go a compounding cream or injection with me. It was, let's go progesterone, let's go DHEA, let's see how that influences. And kind of just like you said, if I'm not feeling any symptoms and there's not a reason, talk to us about the downsides of testosterone, maybe when someone doesn't need it, or just, where it can go bad, where it can go wrong.
Well, if you take bodybuilders, for instance, a lot of young men will order testosterone on the internet, and they take way more than they should. That's going to suppress their production. So as they age, they may only be 35, 38. They're going to have low levels because they suppress their production of testosterone. So, the more not better thing
right.
is going to apply when it comes to testosterone. Many men feel better as they age. 45 and up is typically when we see low testosterone levels in men. Men who have had vasectomies frequently have lower testosterone levels. So if their levels are low and they're symptomatic, then by all means they should supplement.
And women too. If you see this often with women who
definitely
feel a lot better.
It's going to improve quality of life. But for the same reason we don't give testosterone by mouth in women, we don't give testosterone by mouth in men, due to the liver conversion to estrone. So estrone can also cause prostate cancer in men. So we monitor our men's estrone levels and make sure that they're not aromatizing over to estrone. And if they do, then there's things we do to correct that defect. One of the treatments may be lowering their dose.
Okay. And a lot of women may be afraid to take testosterone. And so if you do have someone that you see their results, their blood work came back and showed that it's low, they are symptomatic, and they do start, whether it's a compounded cream or injection, what's some of the feedback you've had from people, women, when they have taken that step and added testosterone injections or cream?
Well, frequently they'll come back in 3 months later and they're just thrilled, and their husbands are thrilled because they have their libido back. I actually had a gentleman who waited in the waiting room until I was free in clinic, and they brought him back, and he hands me an envelope, which I opened, and guess what it was? A $350 gift certificate to a steakhouse.
Seriously.
And I said, "What is this for?" And he said, "For giving me my wife back."
Wow.
So I thought that was quite funny.
Wow. I mean, funny, but also how much that improved her life, and not just her life, his.
Their marriage, everything was vastly improved just by a little bit of testosterone.
And you can imagine it was obviously affecting her libido, it sounds like, but then other aspects of her life, I mean, whether it was from, muscle or brain fog or whatever it might be, that she probably felt so much better in so many other facets. So it's one of those that I think it's something that you don't take lightly, that it's a not something that is going to be your first course of treatment for a lot of people, and you're going to kind of weigh, okay, what am I seeing in blood work versus what are the symptoms that someone's communicating to you, and then you'll decide sort of what's the best treatment there. And always, it sounds to me, taking that very conservative route every time.
Correct. That's correct. I have a very bad dog.
She's like, it is
bad.
dinner time. I've been patient.
She has been trying to get my attention ever since we started this interview.
Well, we're almost wrapped up. So when we're talking about hormone balance and like who can benefit, men, women, like you said, young women with PCOS, perimenopausal women in that 35 to 50 range, the full spectrum. And I think ultimately, when we're talking hormones, as we said in the beginning, it goes way beyond menopause. We're talking, like you said, women, 35 and up who can benefit from progesterone, women who have polycystic ovarian syndrome, hormonal imbalance, who can benefit from that, men who are coming in. So the full spectrum of people that paying attention to what's going on, what symptoms we're feeling, and not just dismissing something like you said, whether it's anxiety or joint pain or issues with sleeping, and not thinking that first step is band-aiding the problem, but looking to see, is there something underlying that's leading to this? So as we said in the beginning, this, when we talk about hormones, optimizing our hormones, we're looking at bioidentical hormones. It goes way beyond menopause. So we're talking men, we're talking women in their 30s and up. We're talking girls with polycystic ovarian syndrome. There's the full spectrum of things that optimizing that hormonal balance can really impact and change our lives and how we feel. And so I think it's really important to know that, especially if something is different or something has changed and we're experiencing maybe something new, like issues with sleeping or anxiety or depression or joint pain, especially if that hasn't always been there and it's something that's relatively new, instead of just looking for that Band-Aid for it, looking instead to see what might be an underlying issue that once we resolve that, not only that particular issue, but maybe so many other things in our life can feel a lot better as well.
Yeah. So when we're trying to help people obtain optimum health, what we've found is every year we see them, they look younger and younger. They lose weight much easier. You can tell when an individual is in balance. They feel better. They look better. They describe a light bulb going off. Just quality of life in general and health as well. And I will put forth our practice probably has lower rates of breast cancer and osteoporosis because we do keep everybody's hormones balanced. It's absolutely essential that the clinician check the levels, make sure that they're not overdosing these patients on hormones. It can be dangerous if they are overdosed. And the key is to help them feel better, look better, become healthier, but not increase risk of breast cancer, blood clots, prostate cancer, uterine cancer, etc. So the balance is essential, and the monitoring.
Looking at, like you said, the dose, enough of that dose to feel that improvement, and without going full steam. It's a very, very small therapeutic dose, just enough to be beneficial and help to treat those symptoms. And as you said, I think it's definitely worth saying it again. If anyone is going down the route of hormones, bioidentical hormones, make sure that you're working with a practitioner that specializes in this, that they know what they're doing. This isn't something to just guess at. You hear that there's a real fine line of balance here. And, as we were talking about, there's hormones that one is converted into another. There's cascades of reactions that'll happen, that too much of one can cause too much of another. And so the imbalances, it's not just as simple as adding in something might be low. So it's going to be really important that you work with someone who is expert in this, who specializes in this, who can monitor regularly blood work, also regular breast examinations, mammograms, blood pressure, screening this regularly. So making sure all of these things are in check, not taking it lightly, going to someone who's an expert, and trusting that these really small changes and what might seem like really small doses, but as you hear Pamela saying, these small doses are what is ultimately going to lead to that tremendous improvement. And starting small is going to be the best way.
That's correct. We do require mammograms and bone densities on our new patients. We bring them back after 3 months to see where their levels are and then tweak a little bit. And then we see our patients twice a year. So it's our office policy to check patients every 6 months, which, if they are going to get into trouble, you can usually catch it very quickly.
Right. And in the notes for this podcast, we'll have links to the Egan Wellness Clinic. We'll have contact info for Pamela Egan as well. And then I'm also linking to an interesting journal article from the National Institutes of Health with a position statement on bioidentical hormones that I think is really helpful as well. So we'll have all of that for you in the episode notes. And Pamela, I really appreciate your time. Thank you so much.
Thank you so much, Molly. I've enjoyed talking with you today.
A tremendous thank you to Pamela Egan for taking the time to walk us through this topic of bioidentical hormones and what all of us can do to maximize our wellness, maximize how we're feeling. Again, it's not just for menopause or premenopause. It's not just for women. There's so much to this. And it's really just knowing about it, knowing what our options are, and learning where we are. Where's that snapshot of where we are right now, and how can we best, if needed, best treat ourselves? Let me know what you think. If you're learning from this, if you're incorporating any of this into your own life, always, I want to hear about it. I am registered dietitian Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. If you would like more Fueled Wellness and Nutrition, please head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. And if you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next week for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life.